So do you have rough and bumpy skin on your arms or legs? Are your arms filled with like tens and hundreds of tiny little pimples and dry tiny bumps? What you have is actually called keratosis pilaris. Now sometimes we get teased for calling it as chicken skin, strawberry legs, or goose-bump skin, but let's get rid of those words and call it for what it is, which is keratosis pilaris or KP. So today I'm actually going to talk about the different types of treatments that are available on the market and how we use it for keratosis pilaris, and to actually compare them and see what works better and what doesn't really work. So join me in. So last week, we looked at keratosis pilaris to have a good understanding of what it is. And we found that it has three problems. One is the keratin plugs clogging up the skin pores, unable to come out. Two is the irritation, the inflammation that is caused to the hair follicles. And three is actually damaging of that sebaceous glands. So the sebum, the oil, the cholesterol are not being produced, therefore our skin barrier is being compromised. So when we look at using products that helps for keratosis pilaris, we want to find something that actually will address those three problems. So the most important thing that we always try to do first is maintain the skin hydration and repair back the skin barrier. So if your skin is damaged, is dry, is flaky, is rough, the first thing you want to do is use a good moisturizer. Now you probably hear it 1,000 times before, and I'm going to say it again, but it is so important, because if our skin barrier function is damaged, then the inflammation will happen to the hair follicles, the irritation to the skin, and therefore the blocked keratin will not be able to exfoliate. So moisturizing is really important, and we want to do that every day, day in, day out, with a really thick, rich moisturizer. So you might hear of the treatment options that I use exfoliants. So that could be your chemical exfoliants or your physical exfoliants. Now, physical exfoliants get a bit of a bad rep about it because of this term called micro skin tear. Well, these terms are actually not real medical terms. And what micro skin tear is a little tear in your skin that are not visible when you look at it, but may be visible under the microscope. So if I'm standing here and I'm scratching myself like this, I'm causing micro skin tear. However, our skin barrier, especially the upper epidermis, it has 20 layers of dead skin cell in the stratum corneum. So when I'm doing that, I'm not going to really damage my skin. Now, however, if I'm doing it really hard, like when you have itchy skin and you're scratching it to the point where it's bleeding, I'm actually not just damaging the stratum corneum. When I see bleeding marks, I'm actually gone further and I'm hitting the dermis area, so where the blood vessels are actually broken and being damaged. Now that is an actual skin tear, and when that happens, we allow bacteria to enter into the skin, our skin barrier is being compromised, and that can lead to complications. For people who've got pigmentations or prone to pigmentation, having this continuous skin tear will actually irritate and inflame the hair follicle, which is the main cause of pigmentation. So as physical exfoliants, are not really recommended by healthcare professionals by that reason, because everyone is so different. I might be doing it and I'm scrubbing it really hard in the shower, like it's never ending. But in reality, well, if we're gonna be in the shower and just gently, circular motion, doing it once a week, we are not gonna have an issue with them. Now, physical exfoliants could be your loofah, your pumic stone, which I would never recommend to use that on the body. That is reserved for the feet. Then you have your sugar scrub, your coffee scrub, your micro beads, which are no longer really used. Then you got your seed scrubs and your nut scrubs. Now again, if you go gentle on them, you go once a week, then they are fine. However, you get to products, for example, like your dry brushing or your exfoliating towels, especially if you've seen the Korean towels, they actually recommend to go really harsh at it. And this is where you need to be careful between, that going really harsh to try to peel off the dead skin cell, or the risk of getting pigmentation and irritation to the skin area. And that's why we prefer to use chemical exfoliants. Chemical exfoliants give us more control. If I'm putting onto my skin and it's stinging, it's red, it's burning, I can wash it off. If I have sensitive skin, I can gradually build up the time frame. So I can put it on for an hour today, wash it off. Tomorrow I'll do 2 hours. Next day I'll do 3 hours. Until after 1 or 2 weeks, then I can leave it on overnight. So you actually can test patch when you use the chemical exfoliants. Chemical exfoliants used could be your lactic acid, glycolic acid, which belongs to the alpha hydroxy groups, and those two are the commonly used of the alpha hydroxy acids. Then you've got into your beta hydroxy acid, which is your salicylic acid, and then you also got urea. So these chemical exfoliants, these 4 agents are commonly used in the management of keratosis pilaris. So with your AHA, your alpha hydroxy acids, glycolic acid molecules are a little bit smaller, so they penetrate deeper into the stratum corneum. They help to shed the skin and increase the skin turnover. So you find a lot of glycolic acid is used even in high percentage in a chemical peel. But in terms of using it for keratosis pilaris, we recommend to go to about maximum of 10 to 20%. And that is the same with lactic acid. Lactic acid is known to be a bit more gentler because lactic acid is a naturally occurring ingredient that we have in our body, especially in our skin and in our gut. So it's more suitable for someone who has sensitive skin. Now, the studies have done and shown that lactic acid 10% applying twice a day for 3 months has shown to a 66% reduction in keratosis pilaris. So when they compare KP reduction, they're looking at 3 things. They're looking at the numbers of bumps and that we have on the area. They're looking at the redness of the area or the uneven skin tone of the area, and they're looking at the roughness, the dryness, and where the water is losing from our skin. So when you see a 66% reduction, that's actually a very good reduction. So with keratosis pilaris, because it is a chronic skin condition, we may not see it go away completely. So when we're using something, if we see, it going from a severity of 10 to 4, according to us, then that's actually a sign that it's a working therapy for us. Your salicylic acid can be used from 0.5% all the way to 6%. Now, salicylic acid is a very interesting ingredient because you can see it also used in acne treatment. So it has like antibacterial activity, anti-inflammatory, it's anti-comedogenic, it helps to exfoliate the skin, it's not reactive to the sun. In keratosis pilaris, with skincare preparations, you will only see about maximum of 2% of salicylic acid in skincare preparation. Anything that is higher than that falls under therapeutic ingredient, which means it has to go through a lot more stricter guidelines in terms of manufacturing and proving its effectiveness. And also it needs to either be prescribed by a GP or personally formulated by your pharmacist for your personal use. So all the skincare preparations out there, if you see they have salicylic acid in their ingredient list, then it could be anywhere from 0.5 up to 2%. And then your third group of ingredient is urea. Now, urea is a naturally occurring ingredient in our body, and it has a natural moisturizing factor, which means it helps to draw water into our skin, retain water in our skin, and keep the skin moisturized. So it's used a lot in different preparations. So we have that in dry skin preparations, we have that in keratosis preparations, we also have that in crack fit preparations. And when it is used at a very high dosage, up to about 40%, it has an antifungal activity, and it actually can help to, almost shed off the nail on your finger. So that can be used in nail treatment. In keratosis pilaris, we use from about 5% to 20% would be the maximum recommendations for keratosis pilaris. So as you can see on this table here, this is just a summary of the different ingredients that are currently used and how they can help for keratosis pilaris. So they all help to exfoliate. AHA can be used in anti-aging product because it helps to increase skin collagen production. They all have antibacterial activity. They have very little benefit in terms of pigmentation, and next week we'll discuss more about pigmentation and we'll explain more about what that means. With AHA and BHA, they can help to reduce inflammation as well, and they help for skin hydration. Now with these ingredients or products that contain these ingredients, they are not your moisturizer. So we don't want you to use them every day, day in, day out, month in, month out, year in, year out. All the studies that were done for keratosis pilaris, treatment range from 1 month up to 4 months. And after that, they actually recommend to reduce it down or to wean it off. And the reason is that we don't want to be using ingredients to continually exfoliating our skin, because when you over exfoliate, the skin actually can become easily irritated, sensitive, and red. So, there is that balance between keeping the skin hydration and maintaining the exfoliation so that we get rid of the roughiness and the bumpiness of the skin. When we look at these 3 ingredient groups, studies have found that combination ingredients tend to work better than single ingredient themselves. So there's studies that were done with 20% urea and 2% salicylic acid, and that was given over a 3-month period, and it found that it has a 75% reduction in terms of KP roughness and bumpiness. So some of the products you will find on the market that contain these ingredients would be your lactin, which contains about 12 to 15% of lactic acid. Then you've got your Paula's Choice Weightless Body Treatment, which has about 2% of the salicylic acid. You've got your KP Duty, which contains 10% lactic acid and 10% urea. You got your Eucerin, which contains 10% urea. Then you got your CeraVe, which contains 10% urea. It has lactic acid and salicylic acid in its formulation, but the company doesn't disclose how much. So this is where I'll talk a bit about my product. So I'm Linda, I'm pharmacist and founder of Beyond KP. And as a KP sufferer and a pharmacist, I developed this passion to really investigate and understand KP better. And this is what led me to formulating Beyond KP Triple Action Smoothing Cream, initially for my customers in the pharmacy, and then now it's available online. So our product contains 10% lactic acid, 2% salicylic acid, and 10% urea. So it is more to target those people, those skins who have tried different products before and they haven't found it to be as effective, and the KP is a little bit more stubborn. You go and see your doctors about keratosis pilaris, you may see your doctor prescribe you different agents. So for example, your doctor might give you topical corticosteroids, and why would they do that? And that is because they want to help to relieve the redness, the irritation, the inflammation that may be present on your skin. Now, these topical corticosteroids are meant to be used for short term only. So they're meant to be used for about 1 week up to 2 weeks, and after that they need to be stopped, and therefore you go back onto your exfoliating creams. So that whether that could be your 2% salicylic acid, your 10 to 20% of urea, and your 10% of your lactic acid or glycolic acid. Another agent that you might see your doctors giving you is your retinoids cream or your vitamin A derivative. Now these creams, I know in Australia is only available through prescription, but overseas in some country it is available over the counter. These creams is a bit stronger than what you will find in your vitamin A or retinols anti-aging range. They help to increase the skin turnover and to increase the skin shedding process. So again, they can be used to help with the bumpiness, the roughness of the skin. One of their side effects is that they can cause dry skin. So it's good to use a moisturizer on top while you're on vitamin A. If you have keratosis pilaris for a very long time and it's very stubborn, it's rough, it's bumpy, there's a lot of pigmentations, and you feel quite conscious and embarrassed about it, and if you have tried the topical treatments and it's not giving you the result that you're hoping for, this is when you should really talk to a doctor and get a referral to see a dermatologist. Because out of all the skincare options that we've talked about, laser therapy is actually still proven to be the most effective for the management of stubborn KP. Now, with laser therapy, there's different types of options. So you've got your Q-switch laser, you've got your fractional CO2 laser, your PDL, your IPL. So I'm not a laser expert, so I'm not going to delve into it and tell you how it works. Out of all the laser treatment, the Q-switch laser has proven to be the most effective. It got the photoacoustic technology with its longer wavelength is able to go deep into the dermal structure. It helps to help with the follicular plugging, so help with exfoliation, and it also destroys the hair follicle itself. Now with this one here, some people have got great results with it where they actually see massive improvement. I'm talking about up to 80, 90, 100%, but it takes time. So treatment needs to be done over 5 to 12 sessions. It might not work straight away, but it needs to be done over that long period of time. Now, IPL and PDL has been shown to be quite effective if you have keratosis pilaris rubra on your face or atropicans on your eyebrows or near your scalp. Now, when you do laser therapy, and this is where I suggest you go to the actual dermatologist rather to any skincare clinic, is the reason of balancing the types of treatment versus the risk of skin damage and risk of pigmentation. So we talked briefly on pigmentation before. When the hair follicles are damaged, so it causes swelling, irritation, inflammation to the area that actually can increase the risk of pigmentation. So before you go down that pathway, it's actually good to talk to your dermatologist and working out this risk and benefit because you don't want to be getting the laser thinking that it will help for pigmentation, but it might give you the opposite result. So to summarize what we have seen in terms of treatment options, so the first step is always your moisturizer. So make sure we really protect that skin barrier of ours and bringing back the moisture into the skin to help with the skin roughness and dryness. And secondly is your exfoliants to help to, release those keratin plaques that are clogging up the skin pores and bringing back the hydration into the skin. And if you have stubborn KP, this is when you should talk to your dermatologist about getting different types of laser treatment. And the Q-switch laser has been proven to be quite effective for people who's getting unresponsive KP from using different other techniques. And lastly, the treatment that we choose can vary differently for different people. And it all depends on the severity of our skin, whether we have a history of pigmentation, the concentration and the formulation of the products that we use, whether we have any existing health conditions. Last week we talked about that to see which health conditions may actually cause KP to flare up even more, and also how invasive we want the treatment to be. So I hope that from today's talk, it has given you a lot of information, but also a lot of awareness about what options there are available for you and to help you make an informed decisions on how to manage your KP better. So all the products that I have mentioned in this talk today are not sponsored by any company, but I am the founder of Beyond KP, so I have talked about Beyond KP Triple Action Smoothing Cream. It is made in Australia and is available for worldwide delivery. Thank you for watching our video and have a happy Easter.